Your show will go live in 5 seconds. 4, 3, 2, 1.
Northwest Liberty News, picking the lock on the shackles of tyranny.
Machines are gonna fail, and the system's gonna fail.
The past is past, the future's now.
Don't look at me. I think these people are completely nuts.
Sometimes trouble just follows a man.
There is another organism on this planet that follows the same pattern. Do you know what it is? A virus.
Can't you stop your lips from flapping for 2 little minutes?
It's because I'm white.
I'm a man. I'm sensitive. I need to feel loved. I need to be desired.
I'm rapidly becoming a big underground success in this town.
It's a question of methods. Everybody wants results, but nobody wants to do what they have to do to get them done.
And now, coming to you live from Kalispell, Montana, brought to you by Northwest Liberty News, it's Montana Gazette Radio with your host, James White. Okay, I'm indeed your host, James White. This is Montana Gazette Radio. Thanks so much for joining us here today on the broadcast on this 19th day of November 2020 as we continue to march on in one of the probably most, in my lifetime, most unusual and I don't know, in some ways stressful, tenseful, tumultuous, incredible, amazing years that I've ever actually had the displeasure is seemingly to live through is 2020. Never ends. The madness doesn't end. We've got lockdowns now across the country in certain blue areas, pretty much telling people they can't have Thanksgiving. There's actually, I saw earlier, and I have to verify this, but apparently there's Zoom meetings with Santa for like $50 now for your kids that actually they don't get to go visit Santa at the mall anymore. They can do a Zoom in with Santa. Presumably they ride directly from the North Pole, and that's why the extra $50 is necessary for a free Zoom call. So anytime I guess there's an opportunity, somebody will move into that space and capitalize on it, I guess. But we're not going to be doing that type of thing here. There's going to be no sitting on Santa Claus's lap on this show. We're just going to talk about truth, and we're going to talk about exposing the criminals that really have ran our entire country and the world, really, my whole lifetime, and likely your whole lifetime as well. We're seeing, now, in Trump, love or hate him, the guy, when he tweets stuff out, when he's certain things, that he's just kind of giving you a precursor to what's coming next. And he's talking about, he just tweeted out here, earlier today, that votes have been being manipulated for years and years and years. I believe that's true. I believe that's true. Of course, the thing of, the big thing is, can you prove it, right? You can, there's things that as I've said on this show before, there's things that you believe, there's things and then there's things you can prove. And of course, we want to give everyone the presumption of innocence until proven guilty by due process. And one of the ways you do that is you present proof for your claims. So we believe in the third. So, do I think that elections have been stolen for years and decades and generations? Sure do. Yep, I sure do. Do I have the proof in my hands to show that? Nope, I don't. But, deductive reasoning tells you it's probably a good chance. Well, in 2018 in California, folks, for crying out loud, all the Republicans won these seats, and then all of a sudden the votes came in a couple days later, and they turned the whole entire, apparently all the congressional districts over with votes that came in after. This is just one big fraud, and we're going to be talking. Next hour. We're going to be shifting gears over here to, some of the stuff going on here in Montana. Specifically, we'll have Brenda Roskos on the second half of the hour talking about the lawsuit that we touched on yesterday. Now the website is now back up and running. It was down yesterday. We were supposed to do a show yesterday, but the website's been down. I don't know if it was under attack or what, but it's back up, and we're going to have Brenda Roskos there. But first, we'll have David Morrill here at 10 o'clock talking about some of the testing and the tracking, the COVID-19 tracking here in Montana with some graphs and some research that he's done. So we're delighted to have them both those guests on the show here coming up at 10 o'clock, starting at 10 o'clock. But until then, in the meantime, what I'd like to do is I would like to go over some of the things on Montana Daily Gazette website and discuss a couple of the things there. And some of these things I talked about yesterday, I believe I was talking about them yesterday, and then next thing you know, they're posted today. I didn't post all these articles, but let's see if I can bring this up here. So here's one I did post. Amazon's move to deliver prescription drugs is a blessing to rural Montanans. And if you're not familiar with this, Amazon, of course, the world's largest online retailer, has now decided to move into the prescription drug arena. So this is no way for me to say that I endorse prescription drugs or I think that people should be on prescription drugs. It's really not why I posted that article. The fact remains is, right, until we're able to somehow find some other method to keep people well, or because it's loaded. I don't really know if drugs keep people well. They may mask the symptoms, but you get my point. Until we can find a better way, especially with senior citizens, the pharmacology industry is going to be here around for a while. I mean, unless some miraculous cure gets released for everything, and hopium's not a very good long-term plan. Regardless, it really is a bonus for people that, whether you love Amazon or not, certainly for people in rural areas, and especially, as I point out in the article, senior citizens who are, in remote areas or some, in places where, the roads get pretty bad here in Montana. The snow sometimes can get bad. The weather can get bad. It can get cold. And not to mention the fact that there's a lot of drunks driving around in Montana on the roads, sadly. And we're, I think, number one in the nation for DUI accidents. So for a variety of reasons, it's good to have Amazon delivering prescription drugs right to the customer's door, especially in rural areas, as I stated. Now, I don't know what the other drug companies are going to do. The Walgreens, the Walmarts, and Rite Aid, or not Walmarts, but Walgreens and Rite Aid, and forget the other one. All their stock took a dump after that. So, Amazon is just, whether you like them or not, folks, they're here to stay. They're not going anywhere. In this particular case, I'm not really a big fan of Amazon necessarily, but in this particular case, I think it's good for certain population for them to be able to have those medications delivered to them. Now, we're going to talk about all this, this, as I stated, we're going to talk more about this COVID-19 and the tracking, and then, that as a result of that, we've got the mask mandates. Another mask mandate starts tomorrow here in Montana. I think people are pretty much just going to ignore it, frankly. I think there's already been some establishments that say they're going to. Here in the Flathead Valley, it's already pretty well been established. The sheriff's not really going to do anything. They can say what they want, but the court has decided against 5 different companies here that they're not going to, they're not going to pursue anything as far as court-wise or legal-wise here in the Flathead Valley. And I don't know how it's going to be in your town. I think each individual town is individual, because you have different people in place, in the court systems there, or health systems, the health department, health officers, I think they're called. So here in Montana, or here in the Flathead Valley, we're so far we've been able to, and I don't really even think the sheriff is ever going to arrest anybody for that. I've talked to him. I don't think he's out there to apprehend criminals. Not wearing a mask is not a criminal act. You may tick people off and may say, well, you're a bad citizen and you don't. Okay, it won't be the first time I've been called that, but it doesn't mean I'm breaking a law. It doesn't mean I'm unlawful. It doesn't mean I deserve to be, arrested for a criminal act. In some towns they will, in some places they will, or fine you, but not here in Flathead Valley. Now, it may be different here in Helena, and let's check this story out here. Democrat health nurse tells Republican lawmakers to stay out of Helena. Oops. A number of low-level health... I love this. I just got to read this first part because I just love this. I love this line here. A number of low-level health bureaucrats, drunk on their sudden power given by Governor Steve Bullock, have arisen as object lessons in the corrupting influence of authority. The names of a few of those more notorious baby Pol Pots and menopausal Mussolinis have risen to public view largely thanks to their unmitigated orgy of usurped political power in their unelected offices. What a sentence. Now that is a, and I didn't write it, that's literary genius right there. I love that. At any rate, what we've got here is you've got these nurses, again, who these people don't make laws. How's the irony of this? The irony, a person that doesn't make laws is telling the person that does make laws not to come to the place where they make the laws. I don't know. It just bizarro world. We're living in 2020 is bizarro world. And again, I usually never stay up for the midnight thing to see the ball drop, and I'm not in those shenanigans. I am this year because I want to see this 2020 gone. I want to see it out. I am really excited to see it leave. So I will be watching it this year I hardly ever do. But this year I will. This year will. 2021 cannot be any crazier, I wouldn't think. Unless Martians start landing in neighborhoods and building colonies in the middle of fields, across rural America. And something like that, besides, I don't see how it can be crazier than 2020. Who knows? I don't. At any rate, I don't believe, as far as I know, the Republican legislators that I know that have been on this show on numerous occasions, I don't think they're going to listen. I think they're going to be there, and they should. They should be there, I think, and that is the way that's the world we're living in now. That's the way of the world. So let's check this out here, and we just talked about this. Steve Bullock strikes back. Governor punishes Montana with renewed lockdown orders. Reeling from a double-digit loss in his race for U.S. Senate, and with only weeks left in the governor's office, Steve Bullock is punishing Montana with renewed lockdown orders. The Montana COVID-19 death rate is still 1/3 that of Planned Parenthood. And it's interesting that he brought that up because I was speaking with someone yesterday in a different matter. And it was specifically was asked how many people compared to how many babies have been killed on a day-to-day basis in Montana compared to how many people have died of COVID-19 in Montana. And that's exactly the numbers that were given to me. It's about 3-1. They're still murdering babies as opposed to people dying of COVID-19. So this is where's the outrage? Where's the outrage of the babies that are being butchered? At a rate 3 times the amount of COVID-19 patients. Pardon me, 3 times the amount. Where's their outrage? Where are the people? Where are the Karens? Where's all the Kens and Karens? Where are they? Nowhere, of course. So we're looking at, pardon me, as I stated before, this is taking effect tomorrow. Mask required in all counties, regardless of case numbers. Now, before it was you only had to wear a mask if your county had X amount of cases, and I don't remember what that number would be, 10, 6, 10, 15, I don't know. But you were only required to wear a mask if you had an X amount of cases or percentage, and I forget how they did the numbers. At any rate, that's out the window now. Now it's broad sweeping across, of course, the entire, all counties, required. Masks are required. What does that mean, required? Okay, so if something's required, let's break that word down for one moment. When something's required, what immediately comes to your mind? Well, it's required because there's been a law passed that makes that, puts that into effect. That's what required means. That's what the typical person would think when you hear the term required. Oh, it's a law then. No, not in this case, right? In this case, no matter how much you like Bullock, no matter if you're a dyed-in-the-wool liberal, like his hair, he's got nice boots, he wears a cowboy hat, so he's cool. It doesn't matter. He doesn't make laws. He doesn't make laws. It doesn't matter how much you like him. It doesn't matter how much the press, plays this out or promotes it. Bullock doesn't make the laws. He doesn't make the laws, right? That's why you have representatives called lawmakers. That's another word for your senators or representatives that go to your capital and bloviate and pontificate. They're lawmakers, not the governor. The governor's not a lawmaker. But here it is. Masks are required by proclamation of who? Not a lawmaker. No. The governor. So masks required in all counties, regardless of case numbers, going to be ignored. Public gatherings limited to 25 people when social distancing is not observed or possible, going to be ignored. Bars, casino, and restaurants to operate at 50% capacity and close by 10 p.m. Probably mostly going to be ignored. I don't know, because what they can do to bars is, of course, as you know, what they'll do is they may not be able to get the health department, but they'll get the Liquor Control Commission. They'll call their buddy on the Liquor Control Commission. Yeah, listen, man. Over there on 4th Street. Yeah, that's the one. Yeah, make it tough then. Make life hard for them because they won't follow the mandate. That's how that operates, right? I mean, we've already established here and was reported on Montana Daily Gazette that Bullock put his operatives out to go into these restaurants to file charges against 5 restaurant owners in the Flathead Valley. Literally, operatives sent out. I didn't even think they're from the Flathead Valley. I think they were from Helena if they tracked these people down. They're from Helena, and they're out there trying to come to Flathead Valley and point out people that don't have the mask mandate followed and turn them over to the health department. So, would they call the Liquor Commission or whoever the name of the organization that issues liquor license and say, we'll take your liquor license away? Yeah, sure, of course they would. Tyrants will do anything they have to remain to solidify their power and to let you know that they're in charge. Of course. You lose your business, your family livelihood, that's all right. Next time you'll listen to me. Next time you'll listen, and now you're an example for everybody else. Now they better listen next time too. That's how tyrants operate. Right? You don't elect, your representatives aren't put in place by the people as their voice to be tyrants and dictators. That's not why we put them there. We put them there to do the will of the people. The will of the people. That's where they derive their power. Right? They may be called the governor. They may say that's an important title. But the only reason that title is important and the only reason they have any authority is because we grant it to them as the people. Right? And that's what has been so far lost in this whole exercise. And maybe when all this is over and the smoke clears, because it's not going to last forever, the Great Reset not going to work. Globalists, if you're watching this show, your Great Reset is going to fail. It's going to fail. Here's the problem that you had. Way too many people. And you always have to do this. This is how it is. As you get down to the point where more and more people find out, you have to expose yourself more and more to keep the con going. And then when you expose yourself, more and more people find out, and then that number grows and you got to expose the con even more. It's just a matter of time before the entire con gets exposed and until you fail. And that's what we're moving towards right now. We are moving towards the exposure. Did you see in Detroit? This hasn't been reported. It's just pretty new. But in Detroit, these people came out in Wayne County. No Wayne County well. As a matter of fact, I used to do volunteer work when I was getting my social work license many, many years ago. I worked at the Wayne County Corrections Center down on the 4th floor where all the insane inmates were. Spent quite a bit of time down there. Had to go through 3 or 4 checkpoints before I could even get in. But my point being is, I know Wayne County well, and they had the election commissioners come out and say they want to change their vote. They don't want to certify, because if you noticed, originally they didn't certify the votes. It was a 2-2 lockup. And then they came back and said, yeah, we're going to go ahead and certify it if the Secretary of State agrees to do some investigations. So it was a 4-0 vote. And now they've come back and said we were threatened. They threatened to dox our family. They threatened our children. That's why we decided to certify it, and we want to rescind our certification. Now, I don't know at this point what's going to happen. I don't know, the minutia of the specific protocol of what happens when someone, casts a vote to certify an election, and then they have, buyer's remorse, I guess you could say, here the next day. I don't really know how that's all going to work out. But the fact of the matter is, it's out there. I don't even know really if it matters, if they accept that or not. The fact that they've come out with affidavits and stated that they are being threatened. They're being threatened by people, within the community. I don't really know if it matters if they rescind their vote or not. I mean, if that gets before the proper judge or proper court, one would think that would all be tossed out anyway. But again, don't know the specifics. Now, from what I'm understanding, yesterday, there were people. They were in Helena yesterday. The legislators were in Helena, and they were voting on their positions there for the upcoming legislature, upcoming 2021 season. I believe that Wiley Galt got Speaker of the House. Maybe Casey Knudsen got pro temp. But both of those gentlemen have been on my broadcast. I'm going to try to reach out to Wiley Galt and see if I can get him here on the show next week to talk about his new position and what he sees in store for 2021 in that position. And we're planning on having a whole lot of legislators on the show here as things continue to go forward. Right now, of course, we're in between the election and then the legislative session that starts in January. So in between that time, there's not going to be as intense politically. We're still going to have some of the representatives on the broadcast here to talk about what their plans are. Now, in tomorrow's show, the first hour of the show, we're going to have, pardon me, we're going to have Ron Gibson on the show. If you've never seen Ron Gibson, or if that's a new name to you, you're not familiar with Ron and the work that he does, you're in for a special treat if you tune in tomorrow. Ron is going to go over the 12 presumptions of the court that you're under when you go into a courtroom. There's 12 presumptions, and I didn't even know about these until Ron came on before and talked about them. And I can't tell you, as I stated, that more people contacted me and said, you got to go over this 12 presumptions things again. That's amazing. We'd never heard of that before. So I talked to Ron. I said, Ron, we're going to give the people what they want. They keep calling about this 12 presumptions of the court. They want that show again. They want you to go back over that again. So that's what we're going to do tomorrow with Ron Gibson. I believe he'll be here in the 9 a.m. hour, and we'll see how it goes. He may stay. If we have questions, I'll open up the phones, and he may stay actually until the both time slots. I just don't know. I'll be moving away from the long form shows here and moving more towards multiple times a day. I'll be doing shorter news briefs. And the only reason I'm doing that, folks, is just because when it's time to talk to, I will have shows where I will talk to legislators and do interviews with them. But generally speaking, on just the non-interview days, I'm going to be doing shorter news briefs because things are happening so fast. I mean, even here yesterday, we talked about this Michigan thing. I mean, in the course of one day, it went from tied and deadlocked until they approved it. And then a few short hours later, they rescinded it. I mean, that's the type of stuff that's happening. That's how fast things are happening. As you know, if you pay attention to anything, you know that things are just moving like never before. Things are happening like never before. So what I'm going to do is I'm going to do multiple brief news updates during the day, and broadcast them across all of these networks. And hopefully at that point, by doing that, we can keep people sort of up to date. I'll be spending more time in Helena this year during the legislative session than ever before. We've already got accommodations there for that. So I'll be doing some of these shows from Helena, probably right on the ground there with some legislators. I don't know when that is going to be, what the schedule is going to look like yet. I haven't figured all that out yet, but for sure I will be there. For sure I'll be there during the inauguration. I think it's the 4th. I'll be there for that. Then we already have a room rented for that. So we'll be doing some interviews with some of the, and speaking to some of the legislators then. So a lot of great stuff coming up here. It's really a great time to be a conservative if you're from Montana. Excuse me, just still coughing up some of these things from this stupid head deal I had. If you're conservative and you're in Montana, then you are loving life because it's really, really turned strongly towards the red, the red portion of the political map, which we were very delighted for sure. And I think even places like Great Falls had a full sweep of all of the seats were swept by Republicans. So we are delighted for that, and we are looking forward to fighting the good fight here and bringing you as much news as we can, as truthful as we can, as fast as we can, as often as we can here on Montana Daily Gazette for the 2021 season, political season. And I'm opening up Zoom here, and David Morrill is going to be on the line with us here in just a couple of minutes. Open up the Zoom now here and have him join us. And we're going to talk about the COVID tracking and specifically what's going on here in Montana. I think he's actually from Colorado. So we're going to bring him on here. He'll just be here just in a moment. What we're going to do first, though, is we're going to take a quick commercial break here, and so we can support our sponsors here on the show. And again, if you want to support this program, you support our sponsors because that's how we continue to stay operating. So we're going to take a quick break here. I imagine David will be jumping on the line here pretty soon. And we get back on the other side, we'll have him join us, and we'll move forward with the show. MontanaDailyGazette.com. That's MontanaDailyGazette.com or MontanaGazetteRadio.com. And, of course, you can always go to the flagship northwestlibertynews.com. We'll be back after these brief messages here. I'm your host, James White. If you like classic cars, exceptional service, and a money-back guarantee, then the Corner Shop in beautiful downtown Kalispell is the place for you. Whether it's an oil change, engine diagnostic, suspension work, or brakes all around, the Corner Shop has you covered. With expert technicians and a free consultation on all services, you can't go wrong with the Corner Shop. Did I mention the classic cars? While you're waiting for your expert service to be performed, take a stroll through the showroom to see Kalispell's smoothest collection of classic cars. The Corner Shop is conveniently located at 1212 South Main, just south of the courthouse. The Corner Shop is open Monday through Friday from 8 a.m. till 5 p.m., so drop by for an appointment or call 755-7777. That's 755-7777. The Corner Shop, Kalispell's full-service auto repair facility.
PatriotPrepared.com carries the leading brands of storable food from Legacy and Heaven's Harvest. Patriot Prepared. Our name says it all. We're dedicated to empowering you to be self-reliant and confident in any circumstance. Whether you want to be prepared in the event of an emergency or you're an outdoor sports enthusiast, PatriotPrepared.com has prepackaged meals and kits for your entire family. Legacy, Heaven's Harvest are known for high-quality, great-tasting, GMO-free, nutritious food with no chemical preservatives. Simple to prepare, easy to store, gluten-free and organic high-quality nutrition options with a 25-year shelf life. You can't beat the feeling of being food secure when you need it most. So go to PatriotPrepared.com right now to pick up your supply of high-quality storable food for your family because it makes good sense to be prepared. That's PatriotPrepared.com.
Okay, folks, if you want to support this broadcast, you can support us by supporting our sponsors. PatriotPrepared.com is a great place to get all your storable food needs met, along with water purification, cooking stoves, that type of thing. And again, all the support you give there to that website helps immediately support this broadcast, so we appreciate that. All right, we're going to switch gears here a little bit. We're going to bring David Morrill on the show. and we're going to talk about this COVID tracking. So let me give him a proper introduction. Let me find the document here. Wrong one. Hold on, folks. Bear with me here. I just had it up. I don't know why I didn't, where it went. There we go. So joining us on the line here is David Morrill. He's an entrepreneur, a small business owner in Denver. He's a sergeant first class from the Colorado Army National Guard. He's a staff writer at Protestia.com, and he's done IT work right here for MontanaDailyGazette.com. And more importantly, he's a concerned citizen using the data the government has provided for our understanding. And let me pop him over here, and then I will bring him right on to the Zoom. And there we go. David Morrill, thanks so much for joining us here on Montana Gazette Radio. We appreciate it.
Hey, James. Good to be with you.
Good to be. You got the full hookup there. You must be a podcaster. Looks like you're rip roaring ready to go. You're the man.
I'm getting into it. Yeah, I'm getting into it.
Well, it's a great thing.
Yeah, Go ahead. How this started was, Colorado, like other states, like Montana, and I think every other state in the union, started, politicians getting on the news and saying, COVID's out of control, the cases are out of control, the hospitalizations are out of control, and I wasn't convinced because we just don't see that, right? We don't see, I know so many people don't know anybody that has suffered any serious consequences from COVID-19. I mean, I've certainly had some friends who have had it. They've maybe gotten a little bit sick, and then they've been okay. And so I didn't buy the hype. And fortunately, in Colorado, the Colorado Department of Public Health and Environment has an open data portal, so you can actually download the raw numbers for COVID reporting. And so I jumped on there and downloaded the information, popped it into Excel, and did some correlations that I think they're important for us to know. They're important for, I think, any concerned citizen to know before they start. Not that a lot of us would anyway, especially conservatives, but before they would acquiesce to the demands made on us. That they would at least see the data for what it is and not just raw case numbers.
And something you bring, that reminds me of, that really sparks my mind here to think about this whole election thing, right? Why wouldn't the other side? I mean, if you want to be considered a fair and legitimate winner, I mean, you become president by beating the man, not cheating the man. I mean, you don't cheat your way in. And why are they so apprehensive about showing all the data and finding out who really won? Same type of principle. They don't want people to see the real data because they know that the real data, it goes against the narrative that they're trying to put out. That's why they don't highlight their real data. Do you see what I'm saying, David? You probably agree.
Well, and it's funny because this same process is being used by, Joe and Jim Hoft at Gateway Pundit to look at election results. So they've actually been downloading the raw, vote totals in places like Michigan and different precincts and counties, and doing this same kind of analysis. It's exposed. I realize it's not COVID related, but it's exposed election fraud. That after in-person voting, mail-in ballots have come in at exactly the same ratios for Trump and Biden in multiple precincts. It's uncanny. It's mathematically impossible. But this same process, and I think this is important because in the sort of COVID era, for those of us that like to debate this stuff on social media or talk with our friends, you'll hear this one a lot. You'll hear, well, where did you get your medical degree from? What are you a doctor? Are you an epidemiologist? Are you a virologist? Et cetera, et cetera. And the truth that I've discovered here is something anybody can do. It's something anybody that can work up an Excel spreadsheet and a graph can figure some of this stuff out. So that this whole idea of credentialing somebody and saying, well, if you don't have the right credentials, you can't have an opinion or you can't know the truth about this is something that's, I would almost argue, is anti-American. Americans, we do things for ourselves. We find out things for ourselves. We trust what people know or what they can prove, not the letters behind their name and their email signature.
Well, we're going to bring it.
It's really important for Americans to realize you don't have to be a doctor to figure this out.
Well, no.
And when we have a situation where on any contentious issue, you're going to have people with credentials on all sides of the issue. The credentialing argument is silly. because they'll say, well, you're a doctor, you can't know this. But to which I respond, yeah, but there are doctors that agree with me. So it sort of washes out that whole idea that somehow a regular, like you say, concerned citizen can't know these things.
Well, here's to a bigger point. I don't have to be a doctor to read the side of the box that says this mask does not protect against COVID-19. I don't think you have to have a medical degree, David, to be able to discern the fact that it says on the box this does not protect against COVID-19. I mean, that's just one example right there. Right. But I know we have web pages here, and I have some documentation. I'm going to have to probably I haven't opened up the Excel document yet, but I will. But I haven't had that loaded in the screen. But I do have the websites here, so let's hit those first, and then let's talk about those for a minute. So here's the first one we have here. Is this an article that you wrote, David, or this
is just my blog that I kind of started up a little while ago just to get my views out there and things, and I kind of walk through this article. I'm walking through why it's important to look at case numbers and hospitalizations. That's the real tricky one right now, hospitalizations. But look at these two things in light of testing. And see, people have this idea that government officials, your state governor, your legislature, your public health experts have some sort of secret access to data that you don't have, but they're actually using the exact same data that we use, which is really important to know. It means that their interpretation of it is they're no more likely to correctly interpret this than you are as a citizen. And why this becomes important, especially in terms of cases and hospitalizations. Before COVID-19, we didn't talk about it. Just to use flu as an example, I know everybody will say, well, the flu and COVID-19 aren't the same. Yeah, right, they're not the same disease. They're not the same ailment. But as far as reporting them, as far as understanding the spread of this, the terminology changed. Right? When before COVID-19, we talked about infections, which were somebody that had the virus in their system. We talked about cases, which was when somebody was sick enough to go to the hospital or the doctor, they would be a case. But now with COVID-19, everybody, whether they're an infection, a case, whatever, as long as they have one viron of COVID-19 in their system that we can test for, they become a case. We lump them all together. So the view that we have of this is very gray. We don't actually see the difference between somebody who's asymptomatic, somebody who's not really a danger to themselves or for others with a disease, and somebody who's got a serious problem that we really need to bring in and treat.
Well, I was trying to get someone on my show from Michigan here last week, and I still may be able to get her next week. But she went to the hospital with her mom, and they basically said, listen, if you say it was COVID-19, everything's going to be paid for. If you don't, it's going to be a really big hospital bill. But just all you got to do is say COVID-19 and sign here, and it's all taken care of. It's like $38,000 or something goes towards the bill. Okay, all right, I'll sign. That sounds great to me. I don't have to pay the bill. Now, I don't know how long. That's one person in Michigan. How often has that went on across the country? You think they just figured it out there? Oh, no. It's systemic.
Right. Well, and the politicians that get behind the mic and they say hospitalizations are out of control, they expect us to assume that a COVID hospitalization is somebody who was at home minding their own business, doing their thing, or hopefully somebody not wearing a mask or flaunting the rules, caught the ailment, they were infected with the virus, started to develop the syndrome, symptomatically. They started to actually have symptoms of COVID-19, and as a result had to go to the hospital. But that's not really what it means. All a COVID hospitalization actually is somebody who's admitted to the hospital who happens to have a positive test for COVID-19. And a lot of hospitals, like here in Colorado, UC Health, they test everybody that comes into the system. So, I mean, you as you're admitted to the hospital, they, by routine now, administer a COVID-19 test, which makes sense because they get more money for a COVID hospitalization. This has been well known for a long time, that somebody admitted to the hospital, the federal government, through the CARES Act, will pay them more for a COVID-19 hospitalization than for just somebody that came in for a hernia repair. And the funny thing is, if you go in for a hernia repair, they'll test you. If you test positive, even with no symptoms at all, you become a COVID hospitalization.
Is that right? If you go in there for a secondary, for a surgery, and you have that as a second, wow, But why not? Hey, if the government's got a checkbook and they're just, writing checks as fast as you can claim COVID patients are hitting the hospital, they're in business to make money, right? I mean, they're still a private company. I mean,
well, and the government damaged their ability to stay in business at the beginning of all this because they said, clear your books. If it's not a COVID person, put their surgery on hold.
Right.
So all of these elective surgeries got kicked down the road. So you have hospitalizations where they're laying off people because the COVID patients aren't filling the hospital like they thought, and they've turned away their hernia repairs and their gallbladder surgeries and all the other things that they could kick down the road. They're not doing.
Well, we have another. Let's see here. We have another graph here. Okay, explain this one if you can. This is from covidtracking.com. Is this your website, covidtracking.com?
No, so COVID tracking, the COVID tracking project is actually the Atlantic, the magazine The Atlantic has been running this since the beginning and pulling data from public sources like the CDC and other places to track COVID's progress in different states. And the reason I ended up on COVID tracking, because Colorado puts this on their open data portal, but Montana's health department, while they publish the data, they don't give you. I couldn't find the raw data, a download for a spreadsheet. So they on Montana's health department's website, they do show the data, but they kind of pre-chew it for you. They don't really let you behind the numbers. And fortunately, COVID Project, you can get behind the numbers for pretty much every state. And why this is important is you saw those graphs that you had up there a little bit higher up, where it looks like by casual observance that cases and hospitalizations are just out of control. It looks like, oh my gosh, COVID this is the second wave we were all told about, and it's going crazy. The problem that you have is that when you correlate that with the tests, with new tests, it correlates almost exactly. So Colorado has held a very steady, since about late June, early July, a very steady 10%. Roughly 10% of the people that are tested for COVID-19, whether in the hospital or out, test positive. Roughly 1 out of 10. So it makes mathematical sense that if you skyrocket your testing, you get a corollary skyrocket in cases and a skyrocket in hospitalizations.
Well, here's example. I just want to put it down as simply as I can here. Let's say if they tested everybody in the country for venereal disease, if they tested everybody in the country, I guarantee you the cases of venereal disease would spike kind of crazy like this. Think about it, folks. If you increase the amount of tests, you're going to increase the amount of positive people they're taking the test.
It becomes a pandemic of discovery, is what I called it.
Yeah,
we're just finding out what's out there. And the best example I came up with, because I'm left-handed, so I said, and that's something that about 1/10 of the population is left-handed. We don't test for it. We don't know that it's out there. But if we ran around, testing for left-handedness, it would be very easy for me to run to a mic, run to a media outlet and say, left-handedness is out of control. Look at the numbers spiking. That's kind of what we're seeing right now at the end of COVID-19. And that's not to say, of course, that's not to say it's not a real ailment. That's not to say that certain demographics aren't vulnerable to this. We all know this. But to say that now we're skyrocketing out of control without looking at the testing is a mistake. It's politicians, in my view, it's politicians scaring people to probably, I would assume, cover up for their own incompetence and their own complicit, being complicit in the economic destruction
or their crimes, basically.
Yeah, in some cases for sure.
And we can never lose sight of the fact that the last time that I have seen the statistics, 99.95% of everyone survives it and moves on, and it's not a problem. I talked to my buddy yesterday in Austin, Texas. He's got like 6 people in it with his children and everything, and his mother-in-law lives with them. He's got like 6 or 7 people in the house. They all got COVID-19. Every one of them is all fine now. Even the 80-something-year-old mother-in-law of his, she wasn't feeling good for a couple of days and had a bit of a fever, but everything's fine now. And that's why go ahead.
It's most common. I think the number one statistical predictor, and I actually have the Montana graph up here. If you don't mind me tossing it up,
no, go ahead.
I'll kind of walk through it. The number one statistical predictor at this point of severity of COVID-19 is the strength of somebody's immune system, which is what we would expect. But what you see here on my Zoom screen, get my head out of the way here. What you'll see here on my Zoom screen, this is the data that I downloaded for Montana, and of course not knowing if it would look the same as Colorado, but it pretty much does. And what you're seeing here is correlation curves that factor in testing, but also one that factors in hospitalizations versus cases. And this is an important one, I think, for Montanans to be aware of. This blue curve here that starts kind of up around the 15% kind of range, and then sort of dies off and seems to flatten out for this sort of second half of the COVID season. This is how many cases of coronavirus in Montana are hospitalizations. And this is good news. This is what we would expect to see for nearing the end of a novel virus and of a pandemic, is fewer and fewer serious cases and fewer people in the hospital that are COVID cases versus the population as a whole in terms of people that have tested positive. But the one trend that is trending up here slightly, this yellow one here, is case positivity. So test positivity. So how many people get tested versus how many people test positive. We see this trending up a little bit, and this is true in Colorado as well, same trend. But we would expect this because we're not just testing randomly, right? Theoretically, we're not testing randomly. We're testing people, more likely to test people that show symptoms of COVID-19 rather than just testing anybody and everybody for any reason. So as we test more, this will trend upward slightly because we're more likely to test people that are positive, that wind up being positive, than people that wind up being negative. But all this is good news for Montana. This is not some sort of reason to lock down. As far as I know, you guys are about to, what Bullock is trying to do some sort of a mask mandate or something, which I expect you guys to ignore.
We're going to ignore in the Flathead Valley. I'm pretty sure of that because this court precedent has already been set here. I know you're familiar with the Montana Daily Gazette. As a matter of fact, Brenda Roskos is going to be on here in about 15 minutes for the second half of the show, and she's going to talk about the lawsuit that they're pulling together, I guess, class action lawsuit, for lack of better terms, for everybody in Montana. Because, as I stated here before, David, just before the lead up to you coming on, Bullock doesn't make laws. Governors don't make laws. They don't make laws, right? And when they say you're required, that's generally, when people see the word required, they're thinking there's a law behind that. That's why they're required to do it. And there's not one. So the whole premise on itself is false. It's all just a straw man. They're trying to take power and assume power that they don't have a constitutional right to assume, frankly. And as far as I'm concerned, the way I look at it, if you violate someone's constitutional rights knowingly, that's a crime. Why isn't the sheriff arresting Bullock? That's what I want to know. He should. He could. Or she could. But I don't think they have the will to do that these days. Not yet, anyway. Hopefully.
And it gets into this gray area. I'm not familiar with exactly how the executive orders are structured in Montana. I know in Colorado it's just been an extension. Mask order, a statewide mask executive order that gets extended every 30 days. But the funny thing is, at least with Colorado statute, the existence of an emergency executive order, according to Colorado statute, is required to have a definable end, a set of standards after which the executive order, the emergency status that justifies the executive order, will be terminated. And unfortunately for us, that doesn't exist. So it just continues to go and continues to go.
You guys don't have.
There doesn't seem to be the political will around here for anybody to really take it seriously.
Yeah, I think there's a lot of states have a 30-day, right? You can have an executive order for 30 days, maybe 45 days. And then if you want to continue it, it has to go before the legislature. You know why, folks? They're the ones that make the laws. The legislature makes the laws. They're called, as I stated before, they're called lawmakers for a reason. And the governor is called the governor for a reason. He's not a lawmaker. He governs. He doesn't make laws. And that's unfortunately, David, the larger point here that I see often, and we've got about 10 minutes left if you want to hit some of these other things, but people just don't know. They don't know. They just are not educated. They believe people like $10 million studios wearing $5,000 suits. They believe that they're telling them the truth every single time that they're on TV, and it's just not the case, man. Everybody's got an angle. It seems like, right? They're pushing something. They're pushing something.
Well, And I've always referred to it as the unholy trinity of big government and big media and academia. That's sort of the liberal unholy trinity. And what you find out, and this is something that the Trump presidency exposed. It blew it wide open. I always thought for the longest time. I mean, I'm pushing 40 now, so I mean I've been watching this stuff for a while. I'm kind of a politico, as you might imagine. And for the longest time, I always thought every cultural battle, every political battle, every sort of binary issue in the country was a left and right issue. So the culture war was left versus right, rich versus poor, black versus white, unfortunately in some cases. But what the Trump presidency really exposed is the actual culture war that is going on in this country is between the politically connected elites and their cronies in Washington, and these people that have grown up in government their whole life. They went to a government school, then they went to a government-funded college, under government scholarships, and then they went right into government, the swamp, proverbial swamp. The real cultural war is between those people and the rest of us kind of on the outside that don't have that kind of access and that kind of power.
And there's a spiritual component to that as well. There's no doubt about it. I mean, we wrestle not against flesh and blood. I made a tweet out earlier, and people can either agree with this or not. There's a world religion. There's one major world religion that's not brought up a lot that has a lot of followers, and that's Luciferianism. And I don't know what else to say, folks, except that's just the way that it is. I mean, these people, they talk about, you see them on TV talking about their God, not the same God probably you and I worship. I'm in most cases, I mean, you think about it, David, and this is a little bit aside, but you have the people like BLM that set a building on fire with children inside and then block the street so the fire department can't get down and put the fire out. Those people are filled with demons. This is a spiritual war that we're in.
Yeah, I think that's true. It becomes a situation, and I think 2020 is the greatest example in our lifetimes that we've ever seen of this. A situation where you see the forces of the world, as it were, the big government, and of course, big media. I include big tech in there as well. I mean, we've seen 2020, we've seen big tech be very clearly on the side of this politically connected elite, this government connected elite, and using all of their power to not just block, for instance, conservative speech or speech that disagrees with the narrative, but even go so far as to try to change the way that people see it, the way they think about it. So it's not just a matter of we're going to stop you from seeing this information, we're going to recharacterize it. We're going to recharacterize it so that when you see it, you actually think reality is something other than what it is. I mean, we're seeing that right now with the election. I mean, we all saw Joe Biden in his silly office of the president-elect logo. That's all kabuki theater, right? That's all smoke and mirrors. It's propaganda. And big tech and big media is in there with them.
But here's the problem, David. I can't tell you how many people sent my wife on Facebook, ask Jim this. Is he, this? I mean, this. I hear this. They reported this. Oh no, Biden's going to win it. He's going to be there. I'm like, it's all fake. It's all fake. It's all a fraud. It's all a sideshow. Like you said, it's all a big con. None of this is official. There's no. I couldn't believe it when I saw him. I could believe it because they'll stoop to anything. But he's standing in front of that board like he's official. Office of the president-elect, like with a seal or something over his shoulder. I'm just like, these people just have no shame. They just lie. You know why, David? Because they hate us. They hate you and me. They can't stand us. They hate humanity. Right? They hate us. And that's why they lie to us so easily. And that's why they propagandize us at every chance they get, because they loathe us. They loathe us. I mean, I don't know what else to say.
Yeah. And as a society, 2020, I don't know if it's because America is rich and fat largely, but we let him get away with it, right? At the beginning, we let him gaslight us about COVID. Now we're letting them, and when I say us, I'm not talking about, those that are listening to your program and who are informed, but the public at large, we're so rich and we're so spoiled in this country, and we're so, at this point, undereducated, maleducated about the way that civics work and the way that our system works, we just let them roll right over us. And the more that happens, the more they're going to do it, the more they're going to get away with it. Watching the big tech CEOs, talking to the Senate, and you can just see they know they're getting away with it. You can see it. You can see it in the way they talk, and you can see it in their eyes and their look. They know if I just say the right lines to the Senate here, they'll let us go, and then we're going to turn around and do the same thing. I've never seen an election before where a YouTube video or Facebook post or Twitter, whatever, has all of this propaganda after every single post. Well, the AP called it for Joe Biden. It's on every post.
Yep. No, absolutely. Well, where can people find out more about what you've got going on, David? Now, it looks like obviously you're a podcaster. So when do you podcast? Do you have a podcast show that you do regularly? Did you do?
No, I'm not. I'm not doing a podcast regularly. I think I'll be starting one up. I'm blogging right now at a news website I set up, churchnewsonline.com, which is, I'll send stuff from time to time. But honestly, at this point, if folks want to engage, in discussion or find out more about this, or they have questions, because I know we move through it pretty fast, they could just find me on Facebook. I mean, it really is just my public profile is fine. It's at David Morrill 96.
2 R's.
David.Morrill 96. I mean, something like that. I'm more than happy to engage with anybody who wants to talk about it. 2
R's and 2 L's. That's important. And I submit to you, David, that if they hadn't seen, how they're doing the whole vaccine push now, you see, that's the next thing. I submit to you, when they put that mask test balloon out there, if a majority of the population would have given them the middle finger and said, yeah, we ain't doing it, you wouldn't be hearing about this vaccine thing now. But the reason that they moved forward is they made the mask proclamation. They all stood back and went, could you believe these suckers? Keep going. Go all the way. They're fools. They're going to do whatever we say. And now you have,
And the masks are, the vaccines are politically useful. I mean, there's a reason that Pfizer held back that announcement until after the election.
Everything's political these days, brother. Everything is political. So check out David Morrill on Facebook. That's Morrill. David, we just got another guest coming up here in a couple minutes. Got to run a commercial. Anything you want to say here in closing before we let you go?
No, thanks for having me, James. I appreciate talking about it. I appreciate that there's outlets like yours that are telling the truth. Unapologetically, unafraid. We need more.
Well, you're welcome back on this broadcast anytime, my friend. You have a slot anytime. I appreciate you looking in today, and thanks so much for your work. Okay, very good. Okay, folks, there goes David Morrill. We appreciate him being on the broadcast here. Let me cut out the Zoom meeting here. We've got Brenda Roskos coming up here just in a minute. She may be on the line actually right now. I'm gonna check the phone system to see if she is called in. Not yet, but she'll be here probably in just in a minute. We're gonna Brenda Roskos calling in. We're gonna be talking about. She really has really done a lot of great work with this lawsuit thing that's going on here. This class action lawsuit, I guess, for lack of better terms. So we're going to try to spin these commercials up here, and when we come back on the other side, we'll have Brenda Roskos if everything's working properly.
PatriotPrepared.com carries the leading brands of storable food from Legacy and Heaven's Harvest. Patriot Prepared. Our name says it all. We're dedicated to empowering you to be self-reliant and confident in any circumstance. Whether you want to be prepared in the event of an emergency or you're an outdoor sports enthusiast, PatriotPrepared.com has prepackaged meals and kits for your entire family. Legacy, Heaven's Harvest are known for high-quality, great-tasting, GMO-free, nutritious food with no chemical preservatives. Simple to prepare, easy to store, gluten-free and organic high-quality nutrition options with a 25-year shelf life. You can't beat the feeling of being food secure when you need it most. So go to PatriotPrepared.com right now to pick up your supply of high-quality storable food for your family, because it makes good sense to be prepared. That's PatriotPrepared.com.
Have you heard of Protovite? The most common health concern today is poor digestive health. Unlike ordinary supplements, Protovite is a liquid multi-nutrient formula with patent-pending absorption technology. A published scientific study proves that Protovite is nutrition that gets in 100% of the time. Protovite uses the highest quality ingredients to rapidly nourish every cell in your body.
My name is Sandra. 6 weeks ago, when I started taking Protovite, I was on 14 taking medications from everything for blood pressure to fibromyalgia. In the first 10 days, my blood sugar dropped 50 points, and my fibromyalgia pain is gone. And so was 12 of the 14 medications that I was taking.
Protovite, nutrition that gets in. Buy Protovite now.
Thank you, Protovite, for giving my life back.
These statements have not been evaluated by the FDA. This product is not intended to diagnose, treat, cure, or prevent any disease. Work with your doctor when taking medications. Make Protovite part of your healthy lifestyle.
Okay, folks, if you want to support this broadcast, you can support our sponsors, and you can get some of the highest quality vitamin nutrition supplements on the market by going to bloodboost.net. That's bloodboost.net, and you can check out all the fine Protovite products there. The great thing about all the products on bloodboost.net is they all help boost your immune system, which is a key these days, especially with everything that's going around. Now, we've just had David Morrill on the line here talking about the testing. And yes, folks, if you perform more tests for anything, COVID, as I said, herpes, it doesn't matter. If you test everybody for these things, the cases are going to go up. Just think about it. So don't always just look at, the cases are rising. Well, yeah, of course, because they're testing more people than ever before. That would just make sense. At any rate, we're going to switch gears here and bring, not really switching gears too much, we're going to bring Brenda Roskos on the line here, and she is going to be talking about this, the case here, the lawsuit that we are going to cover. And I'm bringing it up here on the screen real quick. This is what I'm talking about here is this article that was written by Brenda, published in the Montana Daily Gazette, talking about the Montana law firm that's going to sue the state of Montana for a declarative judgment seeking injunctive relief from the governor's directive. And we are delighted to have Brenda on the show here. We're going to bring her on right now. Brenda Roskos, thanks so much for joining us here on Montana Daily Gazette. It's always delightful to have you back on the program.
Thanks, Jim. Can you hear me?
Oh, I can hear you just fine. Yep.
Okay, sounds great. I'm in my back room here, so if it gets echoey or something, let me know and I'll walk into another room. But anyway,
sure.
I am super excited to be here. And it sounds like you have the website pulled up, and I want to talk about a few things before we actually go into the website and give people instructions.
Go right ahead.
But I know that you record all of these. And I am super excited about that. So I am just urging all of Montana and whoever's listening on, please go back when this is recorded and get this everywhere in the state of Montana and share it with all of your Montanan friends. And here's why. This is a lawsuit. This is very exciting. This is a lawsuit that's against Governor Bullock, the DPHHS, which is the Department of Public Health and Human Services, right, out of Helena. It's against certain health officials and certain health officers. This is actually not a class action lawsuit because those take a while to go through. This is, like you said, actually a declarative judgment seeking injunctive relief from the governor's directives, which is like a restraining order. Now, everybody in every county in Montana is able to go in there as a plaintiff and file a complaint against our governor and the DPHHS and health officers and so forth. And I'll show you how, and I'll explain to you how in a little bit how to get in there and to get into the questionnaire part and to go ahead and put your complaint in there. So that's all very, very exciting. We have three main plaintiffs out of Missoula, out of Bozeman, and out of the Flathead Valley. We also, what's happening is when you go in there as a plaintiff, we'll have thousands of co-plaintiffs. So we're trying to get folks in there right away throughout the state of Montana to become co-plaintiffs, businesses and individuals. And of course, really big kind of items are calamities such as suicides during the lockdown, and we do have a few of those, harm to individuals who couldn't get medical treatment, loss of jobs, incomes, harm via the masking and so forth and so on. Now, this, like I said, I don't really want to go into the website yet because there's something I want to detour off into, which is super exciting. But Quentin Rhodes and Associates from Missoula, Montana, he's a constitutional expert. He is the one, and a godly man. He's the one who put this lawsuit together. Now, one of the things that happened was because of the 5 businesses and all that happened with that, this lawsuit was written like over a period of several months and rewritten over and over again because they were waiting to see what was going to happen with the 5 businesses and so forth and so on. Well, I just actually got word today about those 5 businesses. I want to go into this a little bit. And I have the news here. This is public record now, and it says, speaking of these defendants, the 5 businesses, There's now been counterclaims filed against the DPHHS for abusive process and constitutional violations. These defendants, these 5 businesses, are also seeking a declaratory judgment from the court that as a matter of law, the mask directive is unenforceable by the DPHHS in the state of Montana. So we have this is what's going on, Jim. We have a whole different lawsuit going on with those 5 businesses. Of course, a declarative judgment, right? It's like a restraining order with injunctive matters, and their damages are going to be proven in a jury trial, for instance, for how much damage was suffered and incurred due to the abusive process, reputational damages to the businesses, loss of business, attorney fees. Do you see what's going on here, Jim? At the same time that we have a state lawsuit going on against Bullock, DPHHS, health officers, so forth, in certain counties' health department, simultaneously, we have the defendants from the 5 businesses who have just filed a lawsuit against DPHHS. This could not have been more timed, this is incredible.
Bring it on. Bring it on. Power of the people. I was saying earlier, right, Brenda, we are the government. It's us. They represent us. We have the power. We just have to take it back. We've given it over to them and we've let them run us. It's time to let these people stop running us. We run things, not them.
The timing, Jim, is unbelievable that here this statewide lawsuit is going on simultaneously against Bullock, DPHHS, et cetera. And here we have the 5 defendants of the businesses. This has just been filed, I believe, yesterday. So that's all going forth simultaneously. And if I can pull it together time-wise, I'll probably try to write an article on that specifically for the news online news source for Montana Gazette as well, because that just happened. So anyway, what I'd like to go into now is talking about how I became involved in this. I was contacted by the local plaintiffs here for the state lawsuit that I've been talking about. And the reason why is because I've been an advocate for the people, especially here in Flathead County. So what happened is, a while back, I took affidavits of harm and liability to give to our county commissioners with our petition, which they looked at very seriously and so forth. So I was contacted by some local people to help with this, and I'm really just an advocate for the people. So I'm doing this almost full time now. And what's happening is my phone's ringing off the hook and people are contacting me online. How can I be, a plaintiff in here, and what do I do, and so forth and so on. So we'll explain how to get in there and how to do that. But I'm also on a lot of different patriot groups on Facebook, and I know how to contact people via email. And so this is going statewide. So everybody out there listening, when you see this website, go ahead and take that and spread that through all your email groups, everything online, because this particular lawsuit that I'm talking about now, not the one with the 5 businesses, but this one is going to be filed here pretty soon. And we want as many plaintiffs on there as we can get on there. And like I said, especially very serious matters, but anybody with a mask issue, anybody who's been fired and so forth. I do want to talk just about a particular scenario. This is phenomenal. This is crazy, the stuff that I'm hearing. One gal called me and said, hey, my 18-year-old son's a construction worker. He tested positive 2 weeks ago for COVID on November 2nd because he was forced to get a test because somebody else was tested positive at the construction site. Okay, this is the 18th was yesterday. This kid, he's 18, he was tested positive on November 2nd, sitting there for 16 days in his house, not sick. And the other workers, the other co-workers who were forced to get tested, all 8 of them, same thing, positive tests, not sick people. They're all sitting there drawing unemployment. They probably can't go back to work until they have another test that will maybe come back positive because the testing's so faulty. They've got the health department sent a letter to this kid who's 18 years old, like threatening him. He didn't even know he was positive. The clinic never even got back to him. This is unreal what's happening here. And I can tell you, Jim, this health department here is walking a really, really fine line, and they could be a part of this lawsuit very, very quickly. Bill Berg was notified about a week ago by one of the plaintiffs, letting him know what's happening. And they're being watched very, very closely here, very closely. So,
well, hold on, Brenda. Hold on a second. Here's the thing.
Yeah.
Here's the fact of the matter is you cannot violate a person's constitutional rights under color of law. You can't assume that you can't try to convince a person because of your perceived authority that you can violate their constitutional rights. Right? It's color of law. It's not legal. It's not technically. There's a difference between legal and lawful. Right? It may be quote unquote legal, right, but it's not lawful. It's not lawful for them to do that. They may claim legality because of some 1945 act that was put in place, but as far as like the raw violation of your constitutional rights, they can't do that. No authority can.
Right, and that's what I was going to talk about next, Jim. I want to talk about this, and then I want to go into your website there, or the website you pulled up. But that's exactly what I wanted to talk about. If you actually get inside that lawsuit, and it's a 13-page lawsuit, I've read it 2 or 3 times now, that's what it's all about. See, we have this unconstitutional mask mandate with the locking down of well people, which is against the Montana State Constitution, Article 2, loss of dignity and privacy. We've got Article 2, Section 10. Then, I've just done some, research on myself. If you get into Sections 2 and 3, it defends life, liberties, and to live in a healthy environment. Living in a mask is not a healthy environment. The rights of pursuing life's basic necessities, that is, covers our health. And Section 4 covers things such as self-government, unalienable rights under the Montana State Constitution. Section 6 goes into freedom of assembly. So you see what's going on is our local health departments are disregarding the Montana State Constitution. They're going under all this dictatorial, 50-2-118.
Administrative law. It's administrative law. It's not constitutional law. It's called administrative law, which doesn't usurp constitutional law.
Well, what happens is when you have the Montana State Constitution, it always trumps over, right? All this code and all these statutes. And when the legislature gets in session, I believe, in the winter, and we get all of our new folks in there, a bunch of this crap is going to be gone, hopefully. They'll get rid of all that old junk.
Oh, they will.
With so much dictatorial power, right, this fake power from these health departments and so on. I mean, literally, I believe this 18-year-old that I was talking about earlier got something from the health department saying about him being arrested. I'm getting the paperwork and I'm going to look through it. I mean, this is ridiculous. It's insane. So that's what I'm saying. Our local health department's right on the edge, and they could be liable too and be sued very easily on this. So they're going to have to watch their P's and Q's. So, Jim, if we want to talk about the actual website there, we can get into it. I was really, really impressed with Quentin Rhodes out of Missoula, of Rhodes, Seifert, and Erickson. And one of the reasons why, if you can pull it up there and show people,
I have it. It's
if
up.
you get into what they call if you can note the plaintiffs or the plaintiff responsibilities, I wanted to go through that really quickly, and here's why. I have never, in any legal paperwork I've ever looked at in my life, seen a cover letter or anything like this. And the reason it's so phenomenal is because Quentin is truly a constitutional lawyer. He's a Christian. He's a godly man of character. He's actually a homeschool dad, I believe, as well. I wanted to read through these things really quickly and kind of clear things up for people and just go through them really quickly. They have courage here, right, to face public recrimination and other negative consequences like retaliation. I mean, if you're going to be a patriot and stand up for your rights, you're going to have to come against some of these things. I mean, you're going to have to stand up. Justice, a strong hunger for it, and a willingness to withstand possible injustice in the form of adverse legal rulings. That could happen. Prudence, to know when to fight. I love this part. And when to keep your down and your powder dry. I love it. This guy's a historian, right? Right back from the Revolutionary War. We may have to come to a point, he says, where we can do damage by proceeding to a bad precedent and must face the choice of whether to abandon our sunken cause and withdraw. Then we talk about temperance. He talks about temperance here. Then we need to do, he says here, need commitment, but we also need wisdom and a refined sense of perspective. And I think a lot of people are trying to work in wisdom in this. Clarity. Resources will be required to pay attorney fees and expert witness fees. And I'd like to talk about that. To the best of my knowledge, and people have asked me about this, what about money? What about this and that? To my understanding, you can go right in there as long as you go into that, that website that you're talking about right there. When you bring up the questionnaire to Mr. Rhodes, you can ask him, like, where can I donate? I'd like to donate, or how can I help? Or here's my complaint. And to the best of my knowledge, what's happening is there are donors that are coming in who won't be actual plaintiffs, and then there will be plaintiffs who are donating as well. And then there's what I call the townspeople, the single mom who's had horrible COVID issues because of the COVID madness, or the elderly lockdown, and those people can get in on this as well without having to donate. So that's the beauty of the whole thing, is it's a statewide effort. People are fundraising and so forth, and so if you want to donate to Quentin, get in there and talk to him about it right there under the questionnaire part. We'll pull that up in a minute if you're not on there, Jim. But that everything goes through this website. Any complaint, any plaintiff information, if you want to come against the health department, which I think some people might be doing against the Lincoln County Health Department and other places statewide, go right in there with your complaint against health departments, against health officers. Be really detailed in talking to Quentin about those things. I wanted to just do a couple things back here, go back here to the cover letter, plaintiff responsibilities. Love this part. Faith, whatever happens, God is in control. I love this guy, right? Hope, to believe our efforts will bear fruit either in the short term or failing that in the fullness of time. This is a wonderful, wonderful patriotic cover letter, a call to action for people to be brave, to have faith, and be praying. And this is on a lot of prayer places where people are lifting us up in prayer.
Hold on, Brenda. You mentioned something there that I think is important. You have to have courage, folks. You have to have courage.
Yes.
Like fighting tyranny is not easy stuff, because the tyrants are everywhere, and there's people that you think that are not tyrants, they are, and people you think are on your side, they're not. So freedom is not free. You've heard that statement before. It's not just an expression. You have to constantly guard your liberties, because there's always going to be someone out there trying to take them away from you. We just have to be more mindful of that. We've been so dumbed down by television and sports and entertainment and, Us Magazine and all kinds of stuff, Brenda, that we just haven't paid attention to our rights. I think that's changing. I think there's a whole new crop of people that are more concerned about their rights than ever before. Do you see that as you go through all this? And I know you've talked to lots of people.
Totally.
Go ahead.
There are people who get a hold of me hourly now, and I got one today, as a matter of fact. And I mean, God is good, because it came right on the heels of finding out about these businesses getting back to the DPHHS and giving it to them. And this gal goes, I own a business on Main Street. I don't want to wear a mask. Am I going to get sued? I said, no, you're not going to get sued. Look what's happening. The 5 businesses here won. Not only that, they're turning around and doing a counter, activity, and they're trying to come against DPHHS. And I said, if you don't want to wear a mask in your business, don't wear one. And tell your clients or your people when they come in, they don't have to wear one either. I said, our county attorney, our police, and our sheriff are not going to enforce it. I said, and this health department here can whine at you and threaten you all you want, but you stand up, because look what our businesses are doing here. And look, and then I sent her all this information. Look what we're doing on a statewide, county-wide level. We're coming against Bullock, these health departments, and the DPHHS. No more. There's a group of downtown businesses that are banding together. There's a lot happening here. And people, don't be scared. I mean, if you guys want to get together and don't shut your business down to 50%. If you want it to be 100%, I mean, do it. What are they going to do?
Well, here's the thing, Brenda.
Happening. This is ridiculous.
Brenda, you don't need to have the health department anymore. You don't need to have the sheriff. You don't need to have the police. You've got a bunch of little statists, bunch of little would-be dictators that are running around trying to tell people, trying to control their lives. Like, who are you? Don't tell me. I don't want to wear a mask. I'm not going to wear a mask. If you want to wear one, go right ahead. I mean, it should be everybody's personal choice. And here's the thing, Brenda, as we know this, and I said this like 3 times in the show already today, it says right on the box of the masks, it does not protect against COVID-19. The insurance company, the mask manufacturer's insurance company made them put that on the box so they didn't get sued when people got caught or caught the COVID when they wore a mask. It doesn't even protect it. It says so on the box. What's the madness? It's not about the mask. It's about control. If the mask worked, they wouldn't allow you to wear it. They would not allow you to wear it if it worked.
Well, think about this. Think about what I just said about those 5 businesses. The defendants are seeking a declaratory judgment from the court that as a matter of law, the mask directive is unenforceable by the Department of Public Health and Human Services in the state of Montana. Boom. That's it. You don't want to wear a mask? Don't wear one. You don't want to have people wear them when they come in your business? Don't do it. You businesses out there, you need to stand up. And let me reiterate this again, talking about the lawsuit that I'm talking about that Jim has up there right now for you to see. This is for businesses and individuals. So get in there with your complaints, get in there with your plaintiff views, and stand up for your rights and let Quentin know anything that's been coming against you that you think is illegal. And there's a lot of it, let me tell you. Now, here's the thing, too. We're hoping this can go possibly to the Supreme Court and possibly further. Now, here's the deal. It could even go further than that. Now, think about this. Think about these states that won when they came up with major lawsuits against governors and so forth. We had California, Pennsylvania, Michigan, right, came against the governors imposing arbitrary and unconstitutional overreach of power. This is what we're talking. I think there was Delaware involved in there. I think Wisconsin. There's a lot of this going on. This is the biggie, Jim. This is the one that we've been waiting for forever because there's a lot of plaintiffs going on. We have, I think, even a couple thousand so far. We want as many as possible. It's ready to be filed. It's like a restraining order. That's what a declarative judgment seeking injunctive relief is. That's what it's like, a restraining order. Class action suits take a long time. That's not what this is. We want to come down heavy and come down now, so we just have to hope and pray that a judge allows it to go through, and that's where we're at with it. A lot of people have been asking about vaccinations, and right there in the site that you're on there, it talks about that too, and I'm going to kind of read this here. I wrote this in the Montana Gazette newsline, but I'm going to read this whole paragraph here. So you folks out there fighting vaccines, take heed. This is going to deal with that too. It says the ultimate goal is to eliminate quarantines on well individuals to be free, of the unconstitutional mask mandate and to not be subjected to any type of additional restrictions or forced vaccine. Okay, now, right there on the website, it says, whether in the immediate or distant future, here we go, I'm quoting now from the website, seeking preliminary and injunctive relief relative to all previously and continuously sought after future restrictions of civil liberties, including forced vaccines currently and actively being planned there.
Wait, are you in the part that says the suit? Are you in the lawsuit part? Because I'm trying to find that. Are you in the actual part that says the suit?
What I'm doing is what I'm actually in, Jim, is when you get into there. If you look on the website, there's kind of a, before you go into the actual lawsuit or the plaintiff responsibilities, there's kind of a preview kind of thing before you get into those, and there's a written up portion, and it's in there. It's right in that beginning when you first enter.
Okay, I get
there.
it. Yeah, I get it.
You don't click into the suit.
Got it.
Right. I'm reading out of just the cover letter area there. So that's big, folks, because I have folks around the state, and some are just really fighting that vaccine fight. And they're like, I don't know if this is against vaccines. I'm like, oh, it's against vaccines. Because think about it. Think about it. We get back to that Montana Constitution. I believe it's Article 2, right? Or several of them go into it, defending life and liberties, healthy environments. You know, the idea of our property rights, which is like you were talking about with me on the phone yesterday, Jim, was our body is our property, the autonomy. This lawsuit also goes into that you have a privacy between you against government enforcement to have the right to privacy with a medical provider that you choose. There's a lot of other cases that Quentin has talked about in the lawsuit that he has pulled up for people to read in this 13-page lawsuit. Goes into all sorts of things like that, bodily autonomy, the right to choose what we want for our own health. So absolutely it covers masks, lockdowns, forced vaccines. It's all nonsense. It's coming against all those things. And the fine line, Jim, of quarantining well people. Well, that's what we have going on right now, right? We've got this health department quarantining these 8 construction workers who are literally sitting around making $700 a week from unemployment, playing tiddlywinks. These guys have been sitting around for 16 days. They're probably walking their dogs when they could be out working at their job. And none of them are sick, and they're all testing positive. I revealed this to Governor Holmquist, and she went, "Oh boy!" And that's
Commissioner
right, Pam. Oh boy!
You just elevated Pam from commissioner to governor. I'm sure she would love the position. You mean Commissioner?
Right. It's like
Commissioner Colquitt.
I'm revealing this to the county commissioners because I don't think they even know that this is all happening. Randy Brodell the other day mentioned we've got a lot more positive positive cases through testing, and I said, Randy, that doesn't mean, even though they're positive, I know this is hard for people to grasp. Even though these tests are coming out positive, I said it doesn't mean they're really positive. People aren't sick from them. They're not sick. They're testing positive. I'll tell you why. And I'd love to do this on another show with you. I'd love to put an article in the Montana Gazette because I'm studying the cycle threshold. The reason they're testing positive is because even Fauci says when you get after 35 and in the cycle threshold, what it's counting and what comes up is this non-viable virus material, which is garbage. It's nothing, and it's counting all that as positive. It's ridiculous. It's crazy. It's fraud. So that's for a whole nother time and place. But I'm going to do a write up on that cycle threshold, and I'm counseling with a lot of people and reading up on it, and it's unreal.
We're running towards We're just coming towards the end here, Brenda. Let's send people. We're just coming towards the end of the show here. I didn't realize it was that close. Let's.
No,
okay, so I've got up here. Let me make sure that this is the proper website here. So we want people to go to MontanaTitle50.org, and that's 50 MontanaTitle50.org. And I'm gonna put that in the chat room there. Is that the main website to go to, Brenda? That's the main website to go to for everybody.
Yes.
Okay, let me put that in the chat room here.
Correct. It was .com earlier, but that website had some difficulties. This one's been revised a little bit, so it is MontanaTitle50.org.
And if you don't have to be a business owner, you just have to be a regular person. Anybody, like for example, I know some people whose children, their grades have suffered because they've been in quarantine, and their grades have suffered because they haven't been able to be at class, and they haven't even been sick. They've been well. They're not even ill, but they've been sequestered from class, and now their grades are suffering. Those people have been damaged by this.
Yeah, I'd like to see a lot of those go in because that proves how faulty and fraudulent our testing is according to these cycle thresholds. If we can get a lot of people putting that in, hey, my kid's sitting home playing tiddlywinks, nobody's sick, they tested positive, and they're going to test positive, Jim. Probably if they go in and have a test done, they're going to test positive for 3 or 4 weeks because the testing is so faulty. That's huge. I got a lot of people calling me lately that are business, their bosses and people are trying to fire them because, not wearing a mask, and it's all garbage. So yes, we need as many plaintiffs countywide, statewide, getting in on this, and so much more coming. I'm going to write a couple articles and talk to you in a few days, hopefully, about the cycle thresholds because it's up, folks. University of Montana, their cycle thresholds are 50. The lab declared in Helena the first time that it was up to 45. Let me tell you, in Melbourne, Australia, that was class action lawsuit stuff. That is fraud in Montana.
Well, we're fighting back, folks. We're fighting back, and Brenda Roskos is one of the people at the tip of the spear doing that. Brenda, we appreciate all the work that you've done and the insight that you bring us here in the broadcast and your articles that you write, and we so much appreciate all your work, and please keep us closely informed of what's going on. We talk often, so just let me know what's going on here, and we'll be happy to put it out as fast as we can here on the show and on the website. Very good.
I will do that. Thank you so much, Jim.
Thanks,
Have
Brenda.
a great day and get it out to everybody.
Thanks, hon. You too. Always good to talk to you.
All right. Bye-bye.
Take care. Bye now.
Bye-bye.
Okay, folks, there goes Brenda Roskos. We're back here to the screen. Yeah, we're actually we are fighting back here in Montana, which you should too. It's not we're not special here. We didn't fly in with we're in superhero costumes with capes. We're just regular folks like everybody else. We're just here in this particular valley. We've just decided we got a
90 seconds.
There's our gal from Blog Talk. We appreciate her. We just stand up and say we're not putting up with it anymore, and you can do the same thing. We don't have any special powers or don't have any long, distinguished educational credentials. We're just regular salty there people, and that's who needs to stand up, folks. That's who needs to stand up. Don't let anybody else ever to guard your liberties. It's always going to be up to you.
60 seconds.
Because you can see we're out of time here on the show. I'm just going to go ahead and run the spin out at the end. Appreciate you joining us today. We thank so much for our guests today, Brenda Roskos and David Morrill. We look forward to talking to you again tomorrow with Ron Gibson. Don't miss that show, The 12 Presumptions of the Court. Till next time, James White from Montana Gazette Radio saying bye now.
Ten seconds.